The Banner University Medical Center in Phoenix is implementing a new way to help detect delirium, especially in older patients. Dr. Nimit Agarwal is the Chief of Geriatric Medicine at Banner University Medical Center in Phoenix. It's good to have you here, Doctor. This is called NOVAD, right? What is NOVAD?
So NOVAD stands for Neurological Orientation and Verbal Assessment of Delirium. It's a tool that we use where in the electronic medical record, nurses are already documenting information about patients' care at all times. And what we realized was we used specific elements of that evaluation, and we were able to find that with those evaluations, we can detect delirium a little bit easier. And it makes life easy for our nurses because they're already documenting that information, but we were not using it to our best benefit. And now with those specific elements, we may be able to detect delirium much easier than what we were doing before. More
information is always a better thing.
It is a lot of times. And how do we use that information, I think, is very important.
Before we get too much further on this, give me a definition of delirium.
So delirium is really a state where the brain has these chemicals, these neurotransmitters, which are going all wacky. And it can present in different forms. It can present as confusional states. Patients may not be themselves. We hear often from their family members, hey, dad doesn't look like this normally at home. Something is different. And what is that something which is different? And that could be delirium. It comes in different forms. It can be in hypoactive state or hyperactive state. Hyperactive state is where the chemicals are just going all wacky, right? And they're agitated, they are restless,
yes,
and not connecting to the environment. Hypoactive is the one where just laying down and just kind of sleepy and not interacting with the world, and that's even more challenging.
Does it intersect in any way with dementia, with Alzheimer's, these kinds of things?
Absolutely. So patients with dementia who already have some structural change in the brain happening, those patients are at much higher risk of developing delirium because of an acute medical state, especially when they're in the hospital setting. So absolutely. And what we are also finding in research is patients who develop delirium, they may be at higher risk of developing dementia down the line. So it's a really difficult situation.
And again, NOVAD basically uses information from electronic medical records and these sorts. It sounds like an AI sort of a thing. Are we getting into AI here?
It's almost like that. In fact, there is a lot of work going on in delirium world in relation to AI. I think that might be the future. It should be coming soon.
And the importance of diagnosing delirium early, especially in older patients that are hospitalized.
Absolutely. And the reason why this is important is because for delirium, we don't have treatment, right? For sepsis, for example, we have antibiotics. But for delirium, we don't have any medical treatment, medicine treatment. The treatment really is identifying it early and doing interventions like engaging with the environment, getting families to engage with them, getting them to walk. Those are the things we need to do to improve delirium risk.
But if it's neurotransmitters, wouldn't some sort of antidepressant or the things that go after neurotransmitters, would that jumble things up or affect anything, or is that just too much of a wild card?
No, there are certain medications that we use as a last resort for safety, for example. These are antipsychotic medications like haloperidol or olanzapine and medications like that. But these medications we really want to use very carefully in the lowest possible dose for the shortest period of time because they have an independent risk of bad outcomes. But we use it sometimes when safety becomes a concern, when patient is at risk, they're pulling tubes out or something like that, or they are a risk to other people around them, like the staff at the hospital, nurses or so.
Yeah. And we should mention geriatric care. Arizona's got like 1 million residents over the age of 65. 18% of the population is over the age of 65.
And growing, yeah.
Yeah, I mean, geriatric care almost needs to be on the cutting edge right now, does it not?
Absolutely. And in fact, there are new measures from CMS, from Medicare, which are asking for hospitals to do age-friendly care. Age-friendly care means that we should not be just looking at disease, but we should also think about the patient's mentation, delirium, for example. Make sure they're mobilizing, make sure we are identifying frail older adults, make sure that medications that we are giving are the right medications, and identifying what matters to our patients and doing something about it. And these are new measures that CMS has come out for 2025.
And I guess the bottom line is, don't keep them in the hospital any longer than they need to be there.
Absolutely. Anytime you spend in the hospital, the risk for delirium, the risk for deconditioning, risk for infections is higher. So you want to keep them in the hospital, identify the disease, treat the disease, and get them to the next level of care as soon as we can.
All right, Dr. Nimit Agarwal, again, Banner University Medical Center, NOVAD for delirium. Interesting stuff. Good to have you here. Thanks for joining us.
Thank you so much, Dad.